Hi, my name is Jodie, and I'm going to talk to you about training foundations of informatics for nurses. So my objective in presenting to you today is to present the training plan for this in this training for foundations of informatics, which is intended for senior nurses that are expected to analyze and synthesize clinical data and information from the electronic health record to drive care planning for patients as well as certain patient populations to improve health outcomes. So to start, a little bit of background, informatic core competencies are essential in healthcare and improving care, and observations and survey results have confirmed that there are existing knowledge gaps related to technology and informatics within our nursing population. Evidence also supports that there is insufficient training in higher education in informatics, so informatic training has been ordered by leadership in order to fill those existing knowledge gaps that exist within our nursing population. So big picture process as far as how we're going to develop the training and the course to cover the informatics. And first thing is we're going to do a deep dive analysis to look at the request as well as gather information about what's the existing knowledge to uncover those knowledge gaps that exist and understand the learners better to make sure they're motivated to learn. Then we're going to design the course based on our analysis and our findings. And once we gather all the information, we gather the intended content of the course, we'll develop the course, we'll roll it out to our nurses, and we'll do our evaluation to make sure, one, that the knowledge was gained within our nursing population, as well as did this learning process, was it successful in anything that we learn. We will make modifications to either the training program or the process in which we're developing it. We hope that we will deliver this no longer than 1 month from the beginning to the end of the course. So in the first phase was really looking at the analyze, who is our intended audience, and that's our senior nurses that do to provide direct patient care. And what's the content? And that's the foundational content of informatics. And when it'll be within a month that we will have the deliverable available to you, and we're going to be putting in our learning management system, our LMS, and we're also going to be including an independent work project. Why are we doing it? This is to fill that knowledge gap that's been acknowledged by leadership as well as through empirical evidence that exists. And so we're going to make sure we equip those nurses with the knowledge they need to make informed decisions that will improve patient care. And we're doing it through that assignment of those e-learnings. So during that analysis or the analyze phase, we're going to meet with our subject matter experts to really get a better understanding of what is needed of those nurses what knowledge is needed for those nurses to be able to enter a patient's chart and gather that information and truly analyze and synthesize it. And we're going to ask our SMEs, what do they perceive that nurses lack in being able to interpret that patient data? And are there any particular areas that need more attention than others, like patients with diabetes? And very importantly, is there a leadership endorsement in support of this process and making sure nurses have the time and the resources to dig deeper into the data and analyze it as well as present it at meetings? And will nurses be given time to complete that case study that does require a couple hours post watching that course in our learning management system to be able to complete that project? And simply, do nurses have the tools available? Do they have Excel, PowerPoint, or OneDrive? So some assumptions about the learner are that we understand the nurse to be a senior nurse, so experienced and has developed the clinical skills to make assessments and plan accordingly for their patient care. And they have previous electronic health record use. And most important is that they're interested in learning more about informatics, and then so they're more motivated to learn. So in designing the course, we're going to create objectives. We're going to create our assessment using a rubric for that project. We're going to design a lesson plan, and we're going to identify that mode of delivery, which we've decided on using our LMS, our learning management system. So just big picture summary of our objectives. If you want more details, it is in the notes within this presentation. But the nurses at the end of this training will be able to navigate the electronic record in order to identify, analyze, synthesize key clinical information. They'll be able to use Excel in being able to create a spreadsheet using the data to create graphs, to correlate that data that they extract from the charts. And lastly, they'll be able to create a PowerPoint that presents the case study, any relevant clinical information, those graphs they created in Excel, and make those clinical recommendations to improve the patient and population in the care planning process. So that assessment, or how are we going to demonstrate they're competent in informatics, foundations of informatics, and that would be that final PowerPoint we're expecting them to produce. And so the expectation is that PowerPoint includes at a minimum the background of the case study, the clinical content that they extracted from the chart, those graphs that are using that data plotted against time, and those clinical recommendations that are made that will improve patients and population care planning. So our lesson care plan is going to include overview of informatics, kind of key informatic definitions. How do I navigate an electronic health record? Cloud storage, Excel basics, PowerPoint basics, really to kind of just cover the basics in order to create and complete that final project. So in keeping with our phases, we're now in developing the content. We know what we need to do, and now we're going to develop that course and the syllabus. We'll pilot it in with a small group, get feedback, we'll make our modifications if we need to, and be able to come up with a final product. And we're also going to include a survey to assess our learners as far as their feedback and how we can make improvements to the course. Now that we're done, we've created our course, we're going to deliver it. And we're going to deliver it through our learning management system. We'll assign it out to all of those impacted users, and in this case, it would be our senior nurses. We'll send a targeted email communication, alerting them that it's been assigned to them, and with instructions specific on how to complete that independent project. And we'll also include some kind of frequently asked questions about how to really use that learning management system optimally, because in our experience, a lot of people do kind of trip a little bit in really using the learning management system. So we'll make sure we answer their questions before they even know how to ask it. So the final thing is evaluation. And as we've said, we're going to constantly be evaluating throughout this entire process, and really how can we make it better and make it conducive to the learning for these senior nurses that need to gain the foundations of informatics. So those projects the nurses are going to complete independently. We use a rubric to assess that they've met the key metrics that are expected, and we'll send out that post-training survey to evaluate how we did. So I thank you for your time, and I welcome any questions. My email is at the end, so thank you.